And I'm checking our Facebook. It looks like we are live. I like to give it a second to alert everyone that we're on here, and for those that had a reminder for them to pop on with us. So we'll just wait a couple more minutes. And as you're hopping on, give me a thumbs up so I know that you're tuned in, you're paying attention, and that everything is working just fine. It looks like our board chair, Brian Dice, is on here. Hello, and thank you for hopping on. Thank you for the thumbs up from a couple of folks. So it sounds and looks like we are live. And I am so excited to come back here on this live broadcast. It's actually my second one today, which is almost unheard of on our platforms. You guys are probably sick of me by now, but it's just so much information that I want to be able to share with you. And the best way that we can do that right now is virtually. So if you're just now hopping on with us, you haven't watched any of our videos in the past, please make sure that you like our page, that you're following us so you can get those updates. And then also peruse the video section of our Facebook page where we have live streams that are dating all the way back to March. We've featured experts on how to adapt your business in wake of COVID all the way to electives. And then now we've transitioned more into the reopening phase. And a lot of the content that is being driven or guided has come from the reopening survey that we presently have. And what we're generally doing is finding experts to answer those questions for you. So things like the legal implications of reopening, all the way to insurance and product liability if you're starting to produce things that are outside of your normal line of work. With that being said, most of you are now aware that we hold town halls as educational. They're predominantly industry specific. So we've had folks like the Colorado Business Roundtable, the Motor Carriers Association. We even had a session on mental health because it's been Mental Health Awareness Month, and partners from COPA and CBHC were very interested in sharing some of the resources. Today with us, we have our Tri-County Business Task Force, and they have graciously provided us at least an hour to visit, take up live questions. They've got a wonderful PowerPoint that they'll highlight and some things that they're doing. But along the way, if you hear something that's beneficial to you, or you think of a comment that we should take into account, please type that into the video. If you do have, oh, it looks like Terry says I'm cutting in and out. Can you guys still hear me fine? Everyone on the broadcast can hear me fine? Okay. Terry, I'll try and talk louder. Maybe that's why I might be sounding a little bit quieter than usual. It might also be my chicken that's frying because I haven't had lunch yet. So if you want to send me food, that's also accepted graciously. So back to what I was sharing, Tri-County Health is with us today to share kind of updates on their end. They've got an amazing PowerPoint. They will be taking up questions. So if you have questions that you would like us to address, please type those in the comment section. We will actually take those up at the end of the broadcast so that we can get through as many as possible and be able to address your needs further. If for some reason we don't have an answer for you immediately, we'll be sure to come back with that appropriate answer. So hello, Susan Kochevar, Terry, Carrie, and all of you that are on here. I'll try and give shout outs as best as I can. But without further ado, I'll turn this over to Sue and have her introduce herself, maybe some of who's on here with us, and then we'll pull up the PowerPoint.
Thank you so much. Thank you all for having us. We are part of the business support task force team, taking phone calls and emails from the community to answer questions that they have about reopening safely. And so as part of our team, we have Kathy Statz, Jessica Reeder, and Jennifer Tellis, and then Melissa Sager, who will be here to answer those questions after this quick PowerPoint I'm going to go through just to kind of set the stage as we move forward. Okay, so this is what we're just going to kind of be covering, that safer at home business support. And if we move on to the next slide, you'll see our contact information. And so as part of the reopening task force, you'll see our phone number there, and this will all be shared with you too since it's recorded, but just wanted to point out the phone number there. And then it's also nice for us to get emails from the business community, because then we can respond with the links that take them to the appropriate resources. Like right now, we're getting lots of questions about restaurants reopening, so we can take you right to that state link. And on our webpage, we have a business support guide and a checklist that we share with our businesses just to get them thinking about what to have in place as they're planning to reopen. So those are just some resources that I wanted to share. And then if we go on to the next slide, what we're really looking at is we're going to continue to see this safer at home order evolve. And we're going to be going through different phases until we see the vaccine, treatment, and herd immunity. So that's what we're really here for, is to help navigate and support you as this public health order continues to evolve. And that's just the link to the order there. And then if we go to the next slide, just as you've been hearing, what we can all do is continue to practice that good hygiene, washing our hands frequently, wearing face coverings, and connecting with our neighbors as much as we can virtually. And then moving on to the next slide, I just wanted to touch a little bit more on face coverings. And so CDC has some really great guidance on what those face coverings should be. So fitting snugly but comfortably on your face, secured with the ties or ear loops, allowing for breathing without restriction. And so I included that link on here too, so that, if you go to that link, the CDC has some really good information on face coverings. And then moving on to the next slide, why, this kind of covers the why. Research is showing that those face coverings help block the spread of that COVID-19, especially from people who are asymptomatic and don't know that they have it, and they would be unknowingly spreading it. And, we're seeing cities and many businesses requiring that. And I know in Westminster, that's one of our cities that is requiring the face covering. So wanted to make sure you had all of this, and that Colorado Mask Project is a nice resource because it shares with you, again, some more about the why on face coverings, where to find them, how to make them. So that's kind of a nice resource as well. And our team is getting lots of questions on face coverings, the requirements, summer activities, still lots of questions on pools, personal training, the restaurants reopening. So if these are some of the questions that you have, you're not alone, and we'll be covering some of that on this call today. And then if we move on to the next slide. And in general, when you're looking for information, your Chamber of Commerce is an excellent resource. Small Business Development Center, industries, your city and county websites have a lot on there. And then I did include the link that goes right to our business support at Tri-County, again, the Colorado site. And when it comes to businesses that require licensing, the DORA site is also very nice and covers a lot of things. So wanted to make sure you had that. And then the next slide. These are some other things you'll find on Tri-County's website as we have messaging around this, living with COVID. And so just wanted to share, if you go to our website and click on the COVID areas, you'll be able to get to all of these resources. And then the next slide. One other thing I wanted to mention is the Can Do Colorado site. And this is an opportunity to share either what you're doing innovatively as a business to open safely, or nominate a business that you see that they're doing this really well. So that's a nice site to go to just recognize those folks that are doing a good job as we're all still navigating and trying to learn this safer at home. So with that, I would like to introduce Melissa Sager, and she is here to answer those questions that you have about reopening.
Thanks, Sue. I really appreciate it and really happy to be here. I think that presentation really sets the tone, gives a broad overview of what we're seeing and expecting, and those resources you provided are so fantastic. So I know that this is recorded and the slideshow will be made available, but I hope people take advantage of that, as well as our task force. And just a shout out to my business reopening task force in general. You guys have been amazing, really fantastic folks on board here at Tri-County to help you with these issues that you're having as we move toward gradual reopening. And so happy to have them here too. But with that, I'm happy to take questions.
Yeah, thank you so much, Sue, for that very succinct presentation. And as we've shared, this is a video that's recorded, so we'll keep this live for as long as our page is live on Facebook, which should be indefinitely. And then we'll also push out the PowerPoint on our website on our COVID updates page, in addition to our email broadcast. We do have some questions that have come through, and some folks that have hopped on with us. Hello to you, Brad and Peter. I see you both on here, Tina and several other folks. It looks like Counselor Seymour is on here as well. So it'd be nice to hear from any of our, just kind of on a municipal level, any questions that he might have. So I'll go ahead and pull up. This is more of a appreciative post that we have from Tina Silver. Tina is a business owner on the Adams County side. And so she's just kind of sharing thank you, especially during this time. It's important and relevant contact, and your time is appreciated. So I will go ahead and scroll up here and see what information I can go ahead and pull. And we have Susan asking, when do you expect herd immunity to be reached? Many studies already show that has occurred. So I know there are a lot of articles that are out there, some that are more scientific journals, some that have been broadcasted on the news, and just about various test pilots that have been out there, and some that are also in the works. So I think Susan's question is trying to reiterate that we've heard that there's some positive that's come out of this. How do we know, or when do you expect that would be reached?
It's a really great question, Susan, and for bringing it up. I'm not going to be the very best person to answer that question. We do have medical professionals that can talk way better about herd immunity and the other factors that we're looking for reopening. I will say that it is one of the factors amongst many, including access to a vaccination, when we talk about when is it safe to increase our gathering. And so it's an important point, and I'd encourage you to reach out offline. I'd be happy to connect you to the right person to answer that question.
Okay, so you're going to start seeing Susan's name a lot because she's got a couple questions here. This next question comes in the form of face coverings. That they are concerning. The virus is so small that it can go right through face masks. I spoke to a particular contamination expert. So recently, we also had a broadcast that was with the Westminster Medical Clinic. We had one of our physicians that are in the area kind of touch on the different types of face covering and the level of safety that comes from each one. That's probably the best way to word it, all the way from the N95 to the generic, you're tying a bandana across your face. And so one of the things that I know they referenced was that each one has a different form of a barrier and a strength in protection based on what type of material that's used. So Susan's is more along that line, is general face coverings that are out there might still allow for that contamination to come through the mask.
Yeah, it's a good point. Masks are a huge issue that we're talking about, whether it be a business requiring you to place a face covering before you enter their business, or if you need to wear one when you go to work, or just generally our local governments have taken steps to require masks in public more generally. And so it's a big topic of conversation. What I can say is that we know that cloth face coverings serve as a barrier to the aerosol that spreads COVID-19. And so you're absolutely right that the virus is very small. But as you're talking, if you sneeze or cough, a cloth face covering serves as a barrier to reduce the distance that aerosol spreads to spread the virus. It's true that these are not as effective as an N95 medical mask that you would wear in a medical setting, but it's really to protect others. So it's not necessarily going to protect you from the virus getting to you, but it's going to prevent your aerosol from reaching farther. And so we ask that you wear these out in public when social distancing is difficult to maintain. And so when you're at your local retailer or the grocery store where you may be crossing paths with folks, we ask you to wear that to protect them from your aerosol. And we're working closely with the the community and businesses to discuss how we implement masking more broadly and get folks to adhere to the wearing of masks. I will say that Tri-County has done spot checks of compliance for mask wearing, and we're seeing really great compliance rates across our 3 counties of Adams, Arapahoe, and Douglas. And so we're happy to see that, and we're happy to work with others who have some concerns. So if you do have concerns, please reach out. I'd be happy to chat with you more about that.
We're not quite done with questions from Susan. This next one comes as a follow-up to the face covering. We also had a couple other people hop on, so I just want to recognize Parker. Thank you for hopping on with us, and it looks like Hannah as well. Thanks for chiming in. If you're just now hopping on, we had a very succinct presentation that was provided by Sue. This is our Tri-County experts that are focused really on the business task force side of things to help answer questions that you all might have presently and be able to support in the terms of resources as best as we can the reopening and navigating this next phase. So health concerns regarding face coverings with the growth of bacteria and continually ingesting or breathing in CO2. When do you think the mask requirement will end? And my assumption on this would be as the phase continue, as we move through the next several phases, but if there more clarity would be greatly appreciated.
Yeah, happy to chat about masks more. I will say that in regards to growing bacteria and your mask being moist or warm from your breath, we do recommend regular washing of your cloth face covering. And so ideally you would have a few of these cloth face coverings that you could alternate through. You want to wash them very regularly. And so hopefully you have a few that you can switch those out even throughout the day if you know that you're going to be in close contact with others for an extended period of time. With that, masks are really recommended and required when that social distancing can't be avoided. So in public places, when it's unpredictable, when folks could cross your path, when close contact is unavoidable or unpredictable. Otherwise, when you can maintain that social distance, if you are sitting in your office, for instance, at work, you wouldn't need to keep that on all the time. It's come up for places of worship as well. If you're attending a church service, you can remove that mask when you're seated and not moving. For other businesses and other activities where masking is required, for instance, it's required for all employees, public facing, working with the general public to wear a mask. And so that may look like extended periods of time, an 8-hour shift that you may have to wear a mask. Of course, we hope that you're taking breaks, both to wash your hands as well as to take a break from your mask, but also hope that you have more than one to alternate those should it become moist or warm from extended breathing. But I will say that that moisture that is on your mask is exactly what we're hoping for, because that means it's not out in the air for other people to breathe. But definitely reach out if you have additional concerns or questions about masking. Happy to answer those.
So it looks like we have some comments that are kind of against a mask usage as a form of actually stopping the spread, not effective, and that some of what's being referenced is not as accurate. Are there some, and really I think a lot of this has stemmed from, there's a lot of communication that's going on. And at one point you hear one thing and then you might turn on the TV or read through an article and you hear something else. So is there, something you would reference or share from your end that you would direct people to support some of our discussion pieces right now, or just broadly in support of some of the mask usage?
I don't have something right off the top of my head to refer folks to, because the fact is we don't know. This is a very new situation for us here in Colorado, but also across the globe. And so the use of cloth face coverings is fairly new and still being explored. What we do know is that it does serve as a barrier to some of this aerosol. The extent to which the extent to which it blocks is still being studied and has been studied. There is evidence that it is very effective in blocking, and others still that show not as effective. It is really the best option that we have right now. With medical supplies low, we don't want folks running out to buy those medical grade masks, and they're not necessary for everyday folks to wear. The cloth face coverings really serve as that barrier to the aerosol, and is easily accessible for the general public to purchase and keep on hand. And so that's what we have currently. Those studies are ongoing on effectiveness, and we'd encourage you to keep an eye on those studies. We are also looking for what's most effective. And so should new evidence come about, we're constantly keeping our eyes out for that. We want to provide information that is both useful but accurate to everyone. And so we're closely monitoring that as well here at Tri-County. So check back with us, but right now that is our best option, and studies do show that it serves as that barrier. And so we really encourage folks to wear them, but we understand that some folks have reservations, and we'd encourage you to connect with us here at Tri-County, and also keep your eye out on those studies that are actively happening for effectiveness.
And I think that's a great point that you mentioned. This is continuing to evolve and continuing to change in just being open and receptive to the information that's coming out. I think from a county perspective and even from a community residence, that's really doing our part. Jennifer Ann touched and shared, Fossey said today that people wearing face coverings was being polite. So it looks like there might be some update on it from at least a federal person in particular. And then it looks like CDC, according to her as well, says that asymptomatic people do not spread the virus. So those two might be a couple of things that we can explore, since it seems like they both have come out maybe. We don't necessarily need to touch on that. If we can go to the next comment that's here. This one comes from Terry. This is a great question. We're seeing a lot of variance submissions right now, county specific. So counties are able to request variance, not necessarily from one business for one business in particular, but for a broad industry. And so his question is it possible for a specific business to receive a variance to the self-serve restriction if suitably safety measures are in place? So we've heard this a few times. Self-service has really been more broad than I think what initially was discussed, right? So when we thought about self-serve, we're thinking about the buffet styles and the open things that you have at Whole Foods and things like that, which is obviously more prone to the germs and whatnot. What we have heard recently are like our soft serve establishments and things like that, where it's all closed off and you're going in there and you're getting the item. So you want to touch on that a little bit?
Yeah, it's a really great question and touches on a lot of different issues. The variance process being one, which I'm happy to chat through, but the concerns with self-serve itself. So you mentioned some of them, the concerns with self-serve areas, but another concern with self-serve areas is the lack of control of movement. So when we're moving into this gradual reopening of restaurants, and what we've asked restaurants to put in place are measures that really control how many people are there, when they come, when they go, where they're moving, no walk-ups even to the bar area. Because we don't want folks moving around in that space. It's already very risky. Restaurants are permitted to have up to 50 people, and that's a lot of people in one location. And so crossing paths with that many people is risky. And so those self-service areas where you may be walking to an area to serve yourself and walking back, we're trying to restrict movement as much as possible. Additionally, are the concern with the spread of the virus on the self-serve areas themselves, which is the concern that you outlined. So touching any of those serving spoons or spouts, or touching another person's lid for their drink. So restaurants shouldn't have cups and lids out. We don't want anyone handling anyone else's, or condiments even. We're asking restaurants to use disposable products and single-use condiments and things like that, because we don't want that shared touching of items happening in a self-service area. The variance process is very interesting, and we have been working closely with our counties as well as the state to discuss, what the variance process needs to look like, what those requirements are, what the process should look like. Currently, under the Safer at Home, a variance can be obtained, but it needs to be at the request of the county. And so our county elected officials have been very in tune with what's happening with the variance process and what will work for their community. We have the commissioners are very well suited to connect with the community, to their businesses, to discuss what variances they'd like to seek for their community, what variances would keep their community safe still while expanding opening. And so it really looks different depending on the location. The idea of a variance for a specific business is allowed. As an example, the city of Denver obtained a variance for the botanical gardens. So that was a business-specific variance that they obtained. But what I will say is that the process is enormous. And so the task for the county commissioners and the county government and our businesses and other stakeholders is really robust. So there has to be a deep analysis of the data within the community. Every hospital in the jurisdiction needs to sign off with a letter of support. Tri-County Health Department reviews those plans from the county, as well as the requirements that they've put in place for the specific business. And it's an evolving process where we communicate with each other to discuss what's a good fit, where there may be gaps. Our counties are communicating with the stakeholders and businesses. A suggestion from Tri-County Health, we're suggesting to do this. It's not a good fit for this business or this particular industry. How else could we address this concern in a different way that's a good fit for the particular business or industry? Some background is that public health is not industry experts. And so the businesses that we're hearing from range from hot air balloon businesses to, your standard restaurant, bouncy castles, horse racing, and we just don't know how those industries work. And so we need to hear from the businesses, and the county officials need to hear from the businesses about what are the practical safety measures that we can put in place to address broad areas like protecting employee health, protecting your customers, signage and information. And so Sue mentioned our business checklist, which is a great resource to see what type of requirements we're looking for and what may be applicable to your business, and then jog your thoughts for innovative ways to address some of the concerns within your particular business. The counties, as well as Tri-County, is looking for this feedback from businesses when it comes to a variance. And so if you have suggestions or innovative ways to keep your industry safe as we gradually reopen, we'd encourage you to pass that information on both to the county and to Tri-County. Tri-County Health does not approve variances. We do not have that authority. That authority rests solely with the state. And again, the request for a variance has to come from the county. So Tri-County Health Department is a partner in this work, and we're happy to do that and are working closely with folks. But our ability to grant a variance or allow activities that fall outside of the state's order is just not something that we have the authority to do. But the variance process is a great way to explore gradual reopening.
Great. I think that answers your question, Terry. If you had a follow-up, please comment in the comment section. We'll transition to a couple of different questions that are a little bit outside of masks and outside of variance. We'll come back to those, though. I know how much you love it. We have Counselor Smith that's on here with us. Hello to you, Tim Kaufman and Rion. Thank you for tuning in. Hannah is asking, when will playgrounds and parks reopen? She does have a second one. And the second one is, and is there hope for pools to open this summer?
Yes, two huge things. Pools have maybe not so surprisingly been the very hot topic with summer approaching. Parks and playgrounds, I'll start with first. So currently parks are allowed to be open. What we have communicated to our local governments as well as local entities that control the different parks within our communities is that it's going to look different depending on where you are. So if the tennis courts in your community are prone to gathering, people are really anxious to get on those tennis courts and it's hard to keep people 6 feet apart, we're going to ask for those areas to remain closed. If it's not such a hot area in your community and you can play by yourself and hit a couple balls and not worry about other folks coming into your space, then they can be open. That goes for a variety of facilities within parks, including skate parks, basketball courts, any of those areas, any of those facilities within a park. And it's just going to be case by case. If it's difficult to maintain that social distancing, people aren't adhering to it, those facilities are going to be closed in your area. If it is, if people are adhering to those requirements, the folks are able to put up signage to remind people to keep their distance, then those places can be open. And so it's going to depend. The playground equipment is a little different. Those are still closed. We're worried about kiddos on the playground. We're worried about them touching these shared surfaces, especially young kids that may be, they're just not as aware. And so they're wiping their nose and touching equipment or sneezing. They don't really know how to keep social distance. It's not a natural thing for them. And so they're not staying 6 feet away from other kiddos on the playground. And so it's a little difficult in that space. And so those are still closed, along with pools, for some of the same concerns. Hard to keep distance, can't wear a mask at a pool when you're swimming. It looks a lot different. What we do expect is updated guidance from the state on June 1st, this coming Monday, which will include guidance for pools, which we do think will open. It is going to look a lot different than what you're used to. So what the state is considering, the health department is looking at is everyone keeping 6 feet apart. That shared equipment, pool noodles, kickboards, goggles. We're not going to have just an open bin with shared equipment. Chairs will need to be spaced apart. You'll likely probably have your very own area that you're asked to stay in. Those chairs need to be sanitized after each use. It may look like an appointment. So you go to the pool for your 2-hour block. You come at that time and then you leave. And what we're looking for in that space is what we've been talking about is really controlling who is coming and going, where folks are and when. And the whole idea is to keep folks 6 feet apart and make sure that there's access to sanitation there. You can get your hand sanitizer, but really keeping folks distant, which is difficult in a pool setting. But we do anticipate that guidance on June 1st. And so keep an eye out both with Tri-County Health, but also the State Health Department for updates on that.
I think this next one's a good follow-up to this, a little bit different. So this one is about pools, at least at hotels. And I think the premise of this question, and I might be off, but there's also been discussion when it's more of a private as opposed to public. So when you're looking at hotels, it's not necessarily walk-through traffic. These families aren't coming in with their kiddos and ready to deep dive into those pools. It's generally those travelers or people that are staying there, or the same for the fitness facilities that might be there and other things like that. Is there a difference or clarity that's being provided for a public as opposed to a private pool access?
So right now, all pools are closed under the state's order. The state recently made a clarification for personal training. So personal training can happen in small groups of 4 or less within a pool. And so that may look like your local swim school is allowed to work one-on-one with a kiddo. Your gym, you can swim laps in a pool so long as it's 4 people or less in that setting. In hotels, they are still asked to be closed. Same with homeowners association pools, your community pool, your rec center, still asked to be closed. The private public distinction doesn't matter here. Same as the limitation on gatherings, that's in all settings. But again, June 1st, we do anticipate those guidelines on a gradual reopening of pools, which would include hotel pools.
All right, it looks like this next question comes to us from Peter. While it pulls up, I just want to give a shout out for Josh and Jennifer for hopping on with us. If you're just now coming on, we had a brief update with a presentation that will be made available after. This video is available for replay. We are now in the answering questions live and comments as best as we can before our hour is up. So we have received information and data generally from both of our counties. Being in Jefferson County and Adams County, we're uniquely situated and generally get both of those data points on number of cases. What we've been unable to find, and this is a question that's come up from several different people over the last month or two, was specific to our municipality or specific to our city. So I know that Tri-County is more on the Adams County side, but do we have specific to our city how many people have tested positive for COVID?
Yes, I'm just pulling it up pretty quickly. Our data team at Tri-County Health is really fantastic. And if you haven't had a chance to check out our data dashboards, I would encourage you to do so. It provides really fantastic information in a variety of different ways. And I wish I could share my screen with you, but I'm looking at it now. And it's just for folks listening in, it's the web address is data.tchd.org/COVID-19. And it'll pull you up to our data page. And what I'm seeing here is that Westminster has 284 confirmed cases. This data is updated daily in the evening. So the state has their data, and then we update our website every night. And so this is not accurate as far as to the hour at 3 p.m., but it will be updated again tonight by 6 p.m. And so I encourage you to check back and look at that. But just to look generally, we have a ton of data on here. It includes cases by city and county, but it also has hospitalization data, emergency department admissions, cases by age, by race and ethnicity, cases of those with pre-existing conditions and by age. And so it's very interesting to look through this both for your own particular community, but for the county as a whole. And for our 3-county area, lots of good data resources, maps, and charts that are interesting to take a look at. So I'd encourage you to do that. And I see the website up there, so that's great.
Okay, so it looks like Susan comes back to us from a business lens. She's sharing there's a concern drive-through restaurant staff adjusting their masks and spreading the virus and bacteria. Thoughts on this?
It's interesting. I haven't had that concern brought to my attention before. We are working closely with our businesses, both with education about requirements for masking, but also for employees. How should a mask fit? How should you put it on and take it off? What should you be aware of? And if a mask is fitted properly and fits the wearer, there shouldn't be a need for lots of adjustments. And so it may be that folks that have an improperly fitted mask may have additional trouble. In those drive-through restaurant settings, it's a concern in any setting as far as touching and exchanges. So I went through the drive-through for breakfast this morning, and I took my breakfast out of the bag and unwrapped it without touching it. And then I washed my hands after. And so it's good practice if you're touching any shared surfaces, which would include handing your credit card back and forth, that you're washing your hands after that, especially before eating. But their restaurant employees are wearing gloves in addition to that, and washing their hands frequently, just as they would on a regular basis. And so outside of, make sure you're washing your hands after you touch those shared surfaces. But we are working with folks to make sure they have properly fitted masks and aren't touching their face. So.
Excellent. This next question is related to, so it looks like Tri-County is currently asking for volunteers to sit in parking lots of restaurants, report on businesses wearing or not wearing masks. Can you speak to why this is presently being done? And then maybe, and I think, a primary behind this is, after that data is collected, what then, right?
Yeah, it's a great question. And Jennifer, I'm really glad that you brought it up. We did send a request out to our state partners to look for volunteers to monitor at places of or businesses across our jurisdiction. We had Tri-County staff do an initial survey when we are implementing policies, especially those that are restrictive or ask people to wear masks. We want to be very careful about that, and we want to be as least restrictive as possible. And so when we began considering the idea of a public health order to require masks in public places, we wanted to see if it was needed. Are people wearing masks? We get, as you can imagine, we get a lot of calls about it, but they're pretty polarized. It's either absolutely no one in my community is wearing a mask, or everyone is wearing them, we have nothing to worry about. And so we wanted to have a better idea of what, is it even an issue? Do we need an order to require masks? And what we found in that initial observation, which was just a few of our folks like you said, sitting in a parking lot, looking to see folks going into the store with their masks, or aren't they? And we found really high compliance across our jurisdiction. So we know that folks are wearing their masks, and we're keeping an eye on it to see, do people continue to wear masks as we proceed? And it's a big issue as we talk about reopening. So we know that masks are a tool to protect health. And as we increase the number of people out and about in these places, masking can help stop the spread. And so are we continuing to see this very high rate of wearing masks, or does it fall off, and do we need to increase our education about masks? We have a communications campaign going right now, lots of education out connecting people to resources. Where can you get a mask? But lots of, why do we want this? What's the basis behind it? Someone said before about being polite, but it really is about protecting others, acknowledging that, if you're wearing a mask, I know that you're taking it seriously. You know that I'm taking it seriously. I'm wearing a mask to protect your health, because I know that I can be asymptomatic and not have any symptoms. And if I don't have any symptoms, nothing's going to stop me from going to Target and Costco and out to dinner, and I might cross paths with you. And so we ask folks to wear that mask. But the survey to see what compliance rates are is just to inform our decision making about, do we need to put more information out? Do we need more masks? Do we need information? that kind of thing. And so we'll continue monitoring compliance rates, but again, we're seeing very high compliance rates with masks. And so we're happy with that.
So this next question, I'm trying to rapidly go through some of these last few ones, but why aren't pubs and breweries, distilleries allowed to reopen at this time? So we've heard this as more of a point of contention. So the primary response has been, we're trying to avoid the large type of gathering spaces or things that would attract a large type of gathering. But some of our health precautions include, limiting your hours to 10 o'clock or cutting off by that point, or being able to hold a specific number of people. So it seemed like those types of establishments can implement those practices, separate folks, do cutoff times, and still run their business without running into some of these health issues. But is there, I guess, can you touch a little bit about what we may not be seeing as it relates to that?
Yeah, thanks again, Jennifer. You're asking the great questions. This is a really great example of how Tri-County is advocating for our business community. We do want precautions in place that protect health, but we want to apply those equally across the board, logically, as far as what protects health. And this was a good example. So the state put out guidance that said pubs, breweries, distilleries are not allowed to reopen, but restaurants are. And when we reached out to the state and all of you, the state heard very loudly from the business community. They adjusted the requirements. So the issue with pubs, breweries, distilleries is that they are a bit different traditionally from a restaurant. You go to a brewery to hang out. You may start inside. You may end up outside. Maybe there's some yard games that you play or board games inside. You drink. That's why you're there, is to casually have drinks. And you're not necessarily there for to go and leave like you are at a restaurant, where you go for a meal and then you leave after the meal. And so what the state came back with in adjusted guidance is that these establishments can open so long as they're serving food. And that can be with a food truck, which is pretty common with our breweries and distilleries. But it can be in partnership with a neighboring restaurant as well to serve food in that space. One of the justifications behind that is we don't want folks drinking without eating and not adhering to social distancing. So as I'm sure folks know, you have a couple drinks, it may not be as top priority for you to keep 6 feet away from folks. Kathy? Oh, I think that was my watch that just went off. Sorry about that. But if you've been drinking in that establishment and not eating at all, you may be more likely to not adhere to social distancing requirements. So our breweries have been asked to act like a restaurant. So have a reservation. That may not be the case traditionally with breweries, but to have a reservation before you come. You have an assigned seat. So as opposed to open seating like you might see, it's going to be assigned seating, and you'll eat while you're there. And the idea, again, is to go for a set time, stay in your space with your people, and then leave afterward.
Before I get to, I actually just had a quick question that I had come to mind. So we mentioned food trucks and partnering with a food truck to be able to have them kind of open, and the caveat to that, we had the Brewers Guild come on here with us on the town hall, and they estimated over 70% of breweries will close after their 3rd month of being shut down. So it is an integral part because they contribute so much in our economy. To that end, if you think of, and I don't know how many food trucks are out there, so how many can actually service those breweries and things across the state, does that also include things like catering to the business or food that's delivered to the business? Would that also, or would they have to be physically on site in front of the brewery to qualify? Because again, if people are ordering to the restaurant, or if there's a catering relationship between the brewery and a caterer, for example, then that could fill also the food needs. So I'm curious if that's come up as well.
Yeah, that's a really great question. I'd love to go back and dig into that a little deeper. I'm not entirely sure what that relationship needs to look like. And the order doesn't provide a lot of detail or guidance. So we are in regular conversations with the state, and I'll add that to my list as far as any details they have on what that relationship needs to look like, and using catering as an example, because that hasn't been used before.
Thank you. I think that would be, you know, as we're trying to think of ways that we're allowing businesses to really survive, we need to also be thinking of, you know, how are we providing them the opportunity that they can adapt easier than completely changing their model and then it hurts them in the long run. This question from Carrie touches on police presence. I'm not sure if it's city specific, if she's outside of Westminster, and she's asking this broadly as a way that's impacted Adams County. If it's city specific, Carrie, we will have our Mayor Herbach with us on Monday to ask this in the event of time and everything. If there's something you wanted to touch on from the Adams County side, have you guys seen anything related to police presence or anything like that worth mentioning on this? We can come back to Carrie if not.
Yeah. So we are working with our law enforcement and have been since the beginning. We are focusing on our efforts on responding to some of those bigger concerns, like a business violating, putting their employees or customers at risk, some of that larger scale violating of the Safer at Home order. For things like a party in your neighborhood, you know, law enforcement has to prioritize the calls that they're responding to, and we're looking to remove that high risk for others. And so if your neighbors are having a gathering, you know, it's not advisable, but sometimes law enforcement may prioritize other calls. We'd encourage you to reach out to Tri-County if you're seeing violations of the order too. We are working on enforcement, and at the very least, working on education that we can provide to folks as far as why it's important to adhere to the order.
So this question is more of a statement. Again, it's referencing Health Secretary who shared with the senators that there's no evidence about asymmetric cases or contagious. If that's the case, why would local Tri-County continue to claim that people who are asymptomatic are dangerous to others? It seems disingenuous or ill-informed. And again, you know, I just am sharing this mainly so that everyone has the same information. Maybe we can come back and share guidance or feedback on this. If you wanted to tackle this, we can right now.
So I'm happy to chat more about this. It's the second time it's come up on this call. That I have not seen that information from the CDC. Asymptomatic people can transmit COVID-19, and many folks are asymptomatic with COVID-19. Again, I'd be happy to chat more about that offline and pull together some more information, but please reach out to me if you're hearing something different.
Thank you, Melissa. And it looks like Superintendent Glass is on here with us. Hello to you. And Brian Head, thanks for hopping on. Counselor Smith. Carrie, you did share it is Westminster and some more information. So I'm going to get you an answer from our PD and also have our mayor touch base with you on Monday related to some of those situations that our businesses might be experiencing as well. This next comment comes from Susan. If you have any comments or have just hopped on, we had a quick update with a presentation that will be made available. We're now in the process of answering live questions. We have a few more minutes before we close out. So if you have any questions, please type them into the comment section of this box and we will be able to address that for you. This is in regard to certain establishments, in particular, those personal type of services. You know, if you're thinking of waxing or beauty, hair salons, those when you walk in, generally they're now taking those temperature checks. They're taking in information, might be writing it down, who you are, your name, and things like that. And that might take away from people's comfort level and wanting to do business with them. Is that something that you all will think that will continue forward? So how long do you expect that to continue, where the state is asking for that type of information of those businesses that are operating? And is the health department support to the homes of those citizens?
Susan, I'm so happy that you answered this question, and I hope that I can calm people's fears about this, because the data, the information, I don't even want to say data, the information that is collected from your personal service business when you go remains at that business indefinitely unless there is an outbreak, at which point your local public health agency will reach out. This is not information that's transmitted to the state regularly or anything that we're documenting anywhere. This can simply be a sheet that your salon maintains. I mean, honestly, they probably already have it in a scheduling book. And the idea for that is that it enables contact tracing, which is very important to reopening. Sorry about that. To reopening businesses across the jurisdiction. So what happens is that if we can contact trace folks, if there is an outbreak, if you've had contact with a positive person, this list of contact information allows us to contact you and say, you may have been exposed. You should closely monitor for symptoms. There was an outbreak in this establishment that you visited. But beyond that, that information isn't stored in any way and would only be accessed if Tri-County Health reached out to your local salon and said, we have information that a COVID positive person visited your facility. Which hairdresser did they see? They were in very close contact with a hairdresser. What other clients were in that room at the time? And in this case, and why we have limits on how many folks you can have in a room, it's going to be a very small group of people that were quickly able to say, hey, you were in the same room with someone who tested positive. If you have close relationships with vulnerable people, you should distance yourself for a few days. You should monitor yourself for symptoms closely. But that is not a concern as far as collecting that information. And even when Tri-County receives that information, it's not something that we're then storing indefinitely and only reaching out to those people that may have had contact. So it's not something to be afraid of. And it really enables us to open more. The more we can contact trace, the more we know where a virus is and where it's going. We can lock it down quickly enough that it doesn't spread. And that allows us to open more and have bigger gatherings. So if you have additional questions about contact tracing or the requirements for personal services, please reach out. I'm happy to chat about it more. But I really hope folks aren't worried about that. It's something that lives with your personal care service person. They'd be contacted by a health department official, and it's not something to be worried about.
Absolutely. And I do think, consumer confidence is going to be one of those key things that we try and really bolster so people can go out and support those businesses as they reopen. But that definitely was a great question. We've got some great kudos. Terry is thanking you all for all four of you for speaking today and kind of giving us some updates on our end. Peter as well his comment was awesome. Thank you for, okay, so this was related to the data website that you shared, the data for Westminster in specific. If you are interested in information about number of cases and things of that nature, we've included that website link inside of our comment section that you can reference. So he was as well appreciative for that. And then it looks like, Jennifer, I don't want to lose sight of this. I know Melissa said she'll come back and be sure to touch base on it. So at some point we will come back and just provide some clarity on this, especially if there's so much information that seems to have popped up so much more recently. So we'll be sure to come back with some sort of a statement, hopefully in the next couple of days. So it looks like that's all for the questions that we have and comments. I appreciate everyone that hopped on and watched this live video with us, this live stream, and I appreciate all of our experts that are over at Tri-County Health for taking an opportunity this afternoon. Really an hour long of drilling is what it felt like from different comments and questions that we had, but it really shows that people are out there trying to get as informed as possible and to understand both sides of the equation, because no one has it right. There's not a magical answer. It's working through what we know and what we don't know, trying to figure that out together. So I appreciate you guys taking the time. For those of you that are on here and watching this video on replay, give us that hashtag replay so we know that you watched it. If questions or comments come up after you've digested the information that was shared, or you think about it later on and you want to ask it away, please do comment it here. We have the contact information on the PowerPoint that we'll make available on our website and everything, but know that any comments that come on our video, we always turn around, we shoot that out, we get an answer, and we'll paste it back. We like being transparent. We like coming back to you with an answer so you can keep coming back and staying informed. So before I wrap up, I just want to brag. Tomorrow we'll be back here at 11 a.m. I know you suffered with me twice today. You only get me one time tomorrow. And that'll be with our Adams County Commissioner, Chaz Tedesco. So over a month ago, I believe we had Commissioner Odoricio share kind of what's going on in wake of COVID with Adams County. Chaz Tedesco, or Commissioner Tedesco from District 2, will be sharing kind of in between what's transpired and looking ahead. So we like giving our updates from the county and from our commissioners. Please spend some time with us tomorrow at 11 a.m. I appreciate all of you for being here with us today. Thank you.